A big industrial province near China, Shanghai, named Zhejiang, is battling around 1 million new daily COVID-19 infections. On Sunday, the provincial government said that the number is expected to double in the days ahead. Despite a record surge of cases nationwide, China reported no COVID deaths on the mainland for the 5 days through Saturday, the Chinese Center for Disease Control and Prevention said on Sunday. Citizens and experts have called for more accurate data as infections surged after Beijing made sweeping changes to a zero-COVID policy that had put hundreds of millions of its citizens under relentless lockdowns and battered the world's second-largest economy. Nationwide figures from China had become incomplete as the National Health Commission stopped reporting asymptomatic infections, making it more difficult to track cases. On Sunday, the Commission stopped reporting daily figures, which the China CDC then published. Zhejiang is among the few areas to estimate their recent spikes in infections, including asymptomatic cases. In a statement, the Zhejiang government said that the infection peak is estimated to arrive earlier in the region and to enter a period of elevated level around New Year's Day, during which the daily new infection number will be up to 2 million. Zhejiang, with a population of 65.4 million people, said that among the 13,583 infections being treated in the province's hospital, one patient had severe symptoms caused by COVID, while 242 infections of severe and critical conditions were caused by underlying diseases. China narrowed its definition for reporting COVID deaths, counting only those from COVID-caused pneumonia or respiratory failure, drawing criticism from World Health experts. The World Health Organization has received no data from China on new COVID hospitalizations since Beijing eased its restrictions. The organization says that the data gap might be due to the authorities struggling to tally cases in the world's most populous country. The cities of Qingdao and Dongguan have each estimated tens of thousands of daily COVID infections recently, much higher than the national daily toll without asymptomatic cases. According to state media, the country's healthcare system has been under enormous strain, with staff being asked to work while sick and even retired medical workers in rural communities being rehired to help grassroots efforts. Bolstering the urgency is the approach of the Lunar New Year in January, when huge numbers of people return home. Zhejiang official told a news conference that visits to Zhejiang fever clinics hit 4,08,400 a day, which is 14 times normal levels, which is double in the past week. On Sunday, while citing a Hangzhou health official, state television reported that daily requests to the emergency center in Zhejiang's capital, Hangzhou, have been recently more than tripled on average from last year's level. Late on Saturday, the eastern city of Suzhou said that its emergency line received a record 7,233 calls on Thursday.